Hey there, John FARAHMAND, Ryan Hastie from Balance Physical Therapy. Today we're going to talk about some of the techniques that we use here at Balance Golf Performance to help to optimize your body for your golf swing. We've got 5 avid golfers on our clinical staff here at Balance Physical Therapy. Dr. Hastie happens to be one of them, Dr. Guthrie, Dr. Kanegi, Dr. Mello, and Dr. Munoz. Many of them are also certified through the TITLEIST Performance Institute. What we're going to show you today are some very simple techniques. They're just 3 of many that we use for our golfers who want to optimize their body's function for the sport that they love. Hope you enjoy. So Ryan, please have a seat there on the table. Let's turn your head left and turn right. So as a golfer, you need really great neck rotation or cervical rotation. As we can see from Ryan's rotation there, he's very limited rotating to the left. Okay, so is that going to affect your backswing, or is that going to affect your follow through if you're having trouble turning your head to the left? It's going to be your backswing because the head is turning relative to your trunk to the left. Okay, so we saw that before. Now what we're going to do is we're going to do a very simple technique that we use with many of our golfers at Balance Golf Performance to improve Dr. Hastie's left cervical or left neck turning. Okay, here we go. So go ahead and scoot back to me, toward me, Ryan. Perfecto. Turn right one more time. Let's take a look, and then turn left. Okay, does that feel really restricted? Yeah, on that side, yeah? Okay, so what we're gonna do is we're gonna find your first thoracic vertebra. There you are. And we're gonna block you there. I'm gonna rotate you down to that level. That is pretty stiff, isn't it? Yeah. Okay, I'm gonna put your trapezius and levator muscles up here in your shoulder on slack. We're gonna rotate you to that level, okay? And then we're gonna side bend you down to that level. You okay there? Yeah. Beautiful. I'm gonna come in here real tight with you, and I'm just gonna kind of rock you back and forth. There we go. Beautiful. Did you feel that little pop in there? Okay. Turn right again. Turn left again. How's that feel?
Feels like it moves more.
Okay. And if we extend you up now, go ahead and turn right and left. There it is. So we're going to give you some pectoralis stretching, we're going to give you some thoracic extension exercises and some mobilizations, etc. Okay, Ryan, go ahead and stand up, and I'd like you to practice your backswing and your follow through. And then we're going to do a technique to help with this. Your backswing requires what we call right trunk rotation or right thoracic rotation. So what I'm going to have you do is I'm going to have you come sit on our exam table right here with your right leg all the way over here at this edge, okay? Beautiful, and scoot all the way back so you're nice and supported on the table, and then all the way over toward me. Perfect. So as we just saw, Ryan's right trunk rotation or his backswing is a little bit limited, and so this next technique is going to be geared for our golfers who are having trouble with their backswing or their right trunk rotation, okay? We're going to use a little wedge, and I'm going to ask you to lift up your tush there so I can block you here. For any of you therapists out there watching, this is so that the segments or the section of the spine below where we're going to target stay in relative right side bend, or they stay locked. They don't move, okay? Ryan, go ahead and float your arms up like a genie for me, just like that. Perfect. Now when I say so, what I'd like you to do is to just allow your body to relax, okay, so that I can control your weight. Here we go. We're going to side bend you to your right. And then we're going to unside bend you up to the level that we're going to target. We're going to keep you blocked. And then I'm going to rotate your trunk. Beautiful. How's that feel? Big stretch? Okay, tight. Yes, for me too. Very gently, try to turn your trunk to your left, like you're swinging your club. There you go. And then relax and let it go. And we're going to keep rotating you. Big stretch, isn't it? Rotate to the left again. Hold. Good. Relax. We're going to rotate you even a little bit more. Now, I'm going to try to rotate you to your left. I want you to hold and rotate to your right, please. Turn into me. Turn into me. Good. Hold. Excellent. Okay, beautiful job. Come on up in that same position over there. Let's try your backswing again. See how you feel. Rotates a little easier, yeah? Okay, beautiful. So lastly, every golfer knows that hip tightness or hip stiffness, particularly our older golfers that may be a little bit arthritic in their hip joints, they need a little bit more rotational mobility in their hips. What we're going to do is a very simple stretch that we use for a lot of our Balance Golf Performance clients to loosen up their hip mobility, to allow a little bit more extension, a little bit more rotation, and effectively to help dissociate their trunk from their pelvis. So go ahead and stand up. And what I'd like you to do, using this break here on the table, is to put your hip right at that break in the table and lie face down with your right leg on the table, left leg on the floor. And because you're much taller than I am, I'm going to raise the table up. Does your left leg feel comfortable?
Yeah.
Okay. We're going to use the angle here in the table. We're going to unlock. We're going to extend your hip a little bit, taking care not to extend your back. Is this leg comfy?
Yeah.
Okay. What you're going to feel, Ryan, is relax that leg for me, an enormous stretch in the front of your right thigh. And that's when your resistance really starts to build there. So I'm going to hold. I'm going to introduce a little bit of what we call medial or internal rotation to your hip. Can you feel that winding all the way up into your groin? Yes, sir. Okay. And next, what we're going to do is I'm going to anchor your pelvis to the table, and I'm going to grab your femur or your thigh bone, and I'm going to elevate it a little bit, okay? So we're going to put a little bit of weight through here, and we're going to gently elevate your femur. How does that feel? Big, big stretch. Yes, sir. There's a lot of leverage here. The femur is the largest bone in our body, and we're using that as a lever. Using the table, we're trying to immobilize your pelvis and your lumbar spine, and we're just isolating your hip by using your knee and your hip joint as levers to take up all the slack in your hip flexors. Okay. Now that's just one side. Go ahead and stand, walk that off a little bit, and then try your golf swing, please. Yeah, I know, it feels a lot different, doesn't it? Whew. Perfect. That's all we're looking for. Good. If you think you'll find these techniques helpful or useful for you, for your friends, your family, your golf buddies, please reach out to us at Balance Golf Performance. Visit us at balancept.com or on Instagram, follow us at BalancePTMove. Thanks so much.